Today, I'd like to welcome Dr. Muller-Vahl, a leading German neurologist, to the Movers and Shakers series with the Ryan Lawrence Tourette Syndrome Foundation. Dr. Muller-Vahl is a leading German neurologist and psychiatrist, internationally recognized for her work in Tourette Syndrome and related neuropsychiatric disorders. Dr. Muller-Vahl has spent decades researching the cause, diagnosis, and treatments of Tourette Syndrome, with particular expertise in behavioral therapies, pharmacological treatments, and the neurobiology of tic disorders. She has authored and co-authored numerous scientific publications and is widely regarded as one of Europe's foremost experts in the field. I would like to welcome her today on the show and like to ask her a few questions regarding her work. Thank you for attending today.
Yes, hi.
So first of all, I guess we would like to wonder if you could tell us a bit about your background and what led you to focus your career on Tourette syndrome.
Yes, so as you mentioned it initially correctly, I'm a neurologist and psychiatrist, and this is honestly a quite good combination when caring for patients and people suffering from tic disorders and Tourette syndrome, because on one side it's a movement disorder, therefore it's good to be a neurologist. So you are able to differentiate tics from other movement disorders. And on the other side, we have a lot of psychiatric comorbidities. And when you are also a psychiatrist, you are able not only to diagnose, but also to treat all these psychiatric comorbidities. So this is a perfect combination in my view. And we have here in Hannover, in Germany, an outpatient clinic where we see patients at all ages. So I see children and adults as well. And what we offer is primarily a diagnosis. This is still a very important issue because for families it's important to know, and also for adults. I still see people at age 20 or 30 who do not know exactly what the correct diagnosis is. For all these people, it's very important to receive the correct diagnosis. This is combined with psychoeducation about the cause and the treatment options. And then in addition, of course, we offer all kinds of treatments, or at least recommend treatment strategies, because we see a lot of people who do not come here from my area, and then we have to send them back and recommend treatments locally.
Okay. How would you describe Tourette syndrome typically evolves from childhood to adult?
Yes, so what I explain the families and the patients is tics typically start at age 5 to 7 years, in some people earlier or a bit later, but in most of the people not later than age 12. Then they reach up to a maximum at age 10 to 12 years, and thereafter they slowly decrease spontaneously, and this is a good information for all the patients. In my view, tics do not completely disappear in the majority of patients, but they decrease in more or less all patients. Then in addition, I like to add that we have this age dependency in the course, but in addition, we have spontaneous fluctuations. And in addition, we have environmental factors like stress or sport or relaxation that may increase or decrease tics. So it's a mixture of 3 different aspects that are important to understand the cause of tics.
Great, thank you for that. You've been involved in some groundbreaking research. What recent developments in Tourette's research are most exciting to you right now?
Honestly, this is a slow story, so it's extremely slow. I'm now working in this field for 40 years, something like this. And there is progress, but it's really slow. I would say the most important aspect about 15 years ago was that psychotherapy is effective in the treatment of tics. When I started my career in the Department of Neurology, no one discussed psychotherapy for tics. So this is new, and this enlarges our spectrum for treatment options. What we did here in the recent years was studies on cannabis-based medicine. This is also another option. It's still experimental, but there are a small number of well-designed randomized controlled trials, and all demonstrate that cannabis-based medicine is not in all patients, but in some patients really effective. And what I've learned, that surgical therapy, namely deep brain stimulation, is not that effective and not that wanted by patients as we thought initially. So at least here in our country, only very, very few patients ask for surgical therapy. And I think we have to admit that this kind of treatment is effective for other movement disorders like dystonia, Parkinson's disease, but it seems not a really brilliant option for tics and Tourette's, although we still offer it for really severe affected patients that are otherwise treatment resistant. But I would strongly recommend to carefully select patients for this kind of treatment.
Okay. You covered, next question was going to be about the cannabis therapy, which you touched on. Can you comment about some of the information being released now about these bracelets that people, I believe it's out of the UK. Can you comment on the evidence behind that, or, you know, the success or anything that you know about that device?
Unfortunately, I know only little about it because currently we do not have it here in Germany, so I'm not able to use it or to recommend it to patients. I have seen the device, yes, at one of our European conferences. The company had a booth and demonstrated the treatment. Honestly, I have to say I'm a little bit skeptical about it. First, I have problems to really understand the underlying mechanism. So it would be fantastic if it would work, but I have problems really to understand this. And another problem is that there's only this one single trial that was done by those people who are behind this company. And this is a tricky situation. So I would love to see further data, another well-designed trial, and then I could further comment. So the data we have, they are okay. So based on the data and the published data, it seems to be effective, but honestly, it's only one trial, and further data would be great to finally recommend this. What I currently know is that even in the UK, people have to buy it privately and it cannot be prescribed. So this is also another limitation, of course.
Okay. How does the approach of diagnosing and treating Tourette syndrome in Germany compare to other parts of the world, if there is any difference?
It's hard to answer because, of course, I do not know all countries, but we see a small number of people coming from Eastern European countries. So this seems to be due to less educated doctors at this area. We have in Germany some excellent Tourette outpatient clinics. So I would say for people living here in Germany, with some waiting time, of course, it's no problem to be seen by a doctor who is specialized in Tourette's. And we are in the comfortable situation that here in Germany, we can offer all kinds of treatments. So starting from behavioral therapy, including all kinds of pharmacotherapy, including cannabis-based medication, and also surgical therapy. So all these treatments that are recommended in our guidelines can be offered here.
Okay,
One
great.
huge problem, but this is the same in all countries, there is a lack of trained psychotherapists for habit reversal training, but this is a limitation that exists worldwide as far as I know.
Okay. And what advice would you give to parents who are struggling to support a child with Tourette syndrome?
I think first you really have to psychoeducate the whole family so that they understand the underlying cause, that they understand Tourette's is not only tics, but in most cases also ADHD, OCD, depression, anxiety, and so on and so on. And then I really try to understand what is the problem in the family, or is there a problem? Only a few days ago, I had a family, they said, oh, we had a problem because there was a strong arm jerk and the child had problems when riding at school. But now it disappeared and now everything is fine again. And then I said, okay, but the child has other tics, blinking, head jerks, and so on. Oh, this is not a problem at all. We can live with it. So they were quite relaxed, and it was wonderful to hear that the whole family could accept it. At school, there was no problem. And in some families react very different, and then it's good to explain to them that this kind of view as explained in this family is much better. It's good to accept the situation. It's good to inform your environment, to inform the teachers at school. It's good to do a kind of a training with the children, what to say when someone is asking about the tics, and to make the children strong, how to react. Then I always recommend to inform the teachers at school. So without this information, teachers have a problem to react properly. And then I inform about options for treatment and discuss when and how to decide whether they want a treatment or not. And then another very important information is that there's no need for a treatment at all. So in other words, the patients or the families do not miss anything when today they decide against the treatment. And it's absolutely okay to come back in 1 or 5 or even 10 years and asking at that time for a treatment. It's okay, and you do not miss anything.
Okay. And what message of hope would you like to share with individuals living with Tourette syndrome and their families?
It's hard to say. So this is a very difficult question. What can I say? So I recommend to patients or to families to talk openly about the symptoms, not to hide it, to talk openly about problems. So to mothers, for example, I say it's okay to be stressed by tics. This may occur, and then try to find a solution for it. So it's okay for a mother to say to a child that has loud vocal tics, let's go, let me relax for half an hour, and thereafter we can do something together. So I think it's important to say that tics might be stressful. Sometimes not directly for the tics, but for the situation within the family, psychotherapy for the whole family might be helpful. How to treat the tics, how to behave, and to see what the problems are. But yes, sometimes the situation when there are very severe tics, the situation is hard for the families, and it's important that they have the option to talk about this openly.
Do you think, I know from your standpoint, you do the diagnosis, the treatment and so forth, but I mean, I think when it comes to a lot of associations and the discussion about Tourette's, there seems to be a need for more education. And I think for people like associations, foundations like ours, we try to give information. And I think when it comes to society, I mean, a lot of times it's, misunderstanding about the condition itself and education that's required. Do you agree with that?
Yes, 100%. And this is even more in recent years after this, let's say, outbreak of functional tic-like behaviors. This is something that happened worldwide. And unfortunately, now again, all people in the world, at least in Germany, think all people with Tourette's shout obscene words and do some bizarre things. And this is honestly a little bit a disaster. So we had been on a good way to inform about real Tourette's, and now we are back in 1990 or something like this because of all this misinformation in the world, in social media, and unfortunately also in TV shows and also in cinema. There's soon a movie will come out. The English title is I Swear, and I was a little bit honestly shocked when I saw this, because this is not typical Tourette's, what can be seen there. And this is a pity, because it's again a kind of a misinformation, and it would be much better to inform people properly about this condition. The biggest challenge currently is to really try to differentiate between tics and functional tic-like behaviors.
Yeah.
What I believe is that in a lot of patients we have a combination of both. It's not an either or, but a combination. And this, me including, was overlooked by a lot of experts in recent years. And now in the last, let's say, 3-4 years, I've diagnosed a lot of my patients where I made the diagnosis of Tourette's in the past. I diagnosed them in addition with the functional tic-like behavior. So it's not an either or, but a combination of both.
Okay.
And what I learned from this kind of work in recent years is that most of the patients are really thankful about it. Most of the patients, this is an interesting point, told me, "Oh, doctor, I know that these are two different things." So it's interesting. Patients know this and really struggle with it.
Yep.
When I try to explain the patients what is a tic and what is a typical functional tic-like behavior, movement or vocalization, a lot of patients can agree with this view immediately and explain to me that the premonitory urge, suppressibility, influencing factors, all these things are completely different. And this is so important because treatment is very different, and functional tic-like behaviors can be cured. And it would be really important to better define these two conditions, to find ideally a kind of a biomarker or better clinical characteristics to really say this is this diagnosis and this is that diagnosis, and this is a combination of both. So I think this is very, very important. Here in Germany, we have a lot of doctors who are not well educated in tics and functional tic-like behaviors, and we see a lot of patients with the incorrect diagnosis of Tourette's. People who are sent to us with the diagnosis of treatment-resistant severe Tourette's, but indeed they suffer from either a combination of tics plus functional or only functional tic-like behaviors. And this is the biggest challenge, at least in my view, from the clinical perspective currently.
Okay. I'd like to thank you very much for your time, Dr. Muller-Vahl, and expressing your opinions and your advice on Tourette syndrome. Thank you once again for your time, and I hope we cross paths down the road again sometime.
Yes, you're welcome. Thank you so much.